My name is Ranjiv Choudhary. I'm the Cardiac Catheterization Laboratory Director and an Interventional Cardiologist. We are a STEMI certified center and we aim to provide the best cardiac care that we can. STEMI is a technical term in the sense that when you see a person's EKG, if there are certain changes that we look for in somebody that's having an acute heart attack, that happens if an artery is completely blocked and then there are major changes on the EKG. That's when we bring the patients in immediately and open up an artery. People can of course have chest pains and have a pattern of what we call unstable angina or acute coronary syndrome, where they haven't completely blocked the artery but it's narrow and restricting flow. In those cases we may have a little bit of time to figure it out and then bring them in if necessary. But people that have a complete obstruction, they are the ones that are defined as having a STEMI, and it's really a term based on the appearance of the EKG. A severe one typically is when the artery is blocked, as I stated, and the EKG is grossly abnormal. A stuttering pattern of a heart attack where a person may have chest pain but the artery is not fully blocked, maybe 90 or 95% blocked, or maybe a little bit less. They may have chest pain with very little activity or sometimes at rest. EKG may look normal or slightly abnormal. The blood test that we do, specifically a test called troponin, may be elevated. We have very sensitive tests now at Palmdale Regional that can pick up very, very small amounts of troponins which are indicative of heart damage, and those patients we look at to bring them to the Cath lab if we deem it necessary. The troponin level is so sensitive that any other type of injury to the heart is also picked up, i.e. if somebody is septic or somebody has bad pneumonia, somebody's had trauma to the chest, or if they've been using illicit drugs, that can damage the heart. So that raises the troponins, and that's a slightly different group to the ones in whom it's related to a blockage or a narrowing of our arteries. The troponins can be elevated for direct heart-related reasons where the artery is blocked, or they may be a bystander type of elevation because of things going on in the body. If somebody dropped their blood pressure because of severe hemorrhaging, somebody is septic, somebody is infected. People with the COVID-19 used to have or have had troponin elevations, just like with other viral illnesses that can happen as well. You have to differentiate whether it's something that requires a person to have their artery open versus a troponin elevation due to not directly artery related reasons, but as we might call it, demand ischemia, where the heart is compromised because it's not able to pump enough blood. The classic symptoms if somebody is having a heart attack would be severe chest discomfort, which is not defined to one particular spot, but it's a vague general type of discomfort. Those patients usually can't say that it's in one spot. It's usually a severe pressure generalized in the mid part of the chest. It may radiate to the neck or the jaw. It may radiate to the left arm, or it may be in the back as well. Right arm usually is not too often that the pain radiates to, but it's typically chest, arms, jaw, and back. There are actually sufficient number of patients that can have a major heart attack with absolutely zero pain. You look at the EKG and they've had a massive heart attack, yet they had no idea they had one. They just felt a little under the weather and thought they might have had the flu some weeks ago, and then when we look at their electrocardiogram and assess the heart, we found that they had a major heart attack. So that can happen, and those are the concerning cases, because if you have typical type of chest discomfort, that makes it relatively straightforward to diagnose, but there are plenty of people that don't have typical type of pain. So it's really requires a little bit of detective work in the emergency room and by us to do the right thing. Yes, it's been a difficult time with this whole COVID pandemic. People have not been able to do that or have been reluctant to step out of the house. We've had occasional cases where patients have had a bad outcome because they either did not realize that the symptoms they were having were heart related, or were reticent to go and visit a physician because they thought they might catch COVID. But in the scheme of things, ours is a very safe hospital. Everybody has their own room. There's not a lot of mixing. So I think they can be reassured that if they come to us, they'll be well taken care of and will be safe from contamination of COVID from staff and other members. We really try to be very careful. The biggest problem that we face sometimes is the lack of recognition by a patient that the problem is cardiac related. We've had 2 patients last week that were having chest pains and waited for 16-18 hours at home. By the time they came to the hospital, the damage had been done, and even though we opened the arteries, the benefit is not that much. On the other hand, about 3 days ago, we had a lady of 45 without any cardiac risk factors other than high blood pressure, who was having chest pains on and off, on and off. She came in quickly. The EKG was abnormal. We took her straight to the Cath lab. Her major artery, called the widowmaker normally, was 99% blocked. We opened it. There was no damage to the heart. Put a stent in there. She went home the next day. It's perfect. That was really good, made us feel very happy that we did a good job, as opposed to the 2 other patients, one who stayed home and eventually called the paramedics, and the second one who walked in to the front of the hospital. And the problem with that is that you cannot get immediate attention because it's not realized that you're actually having a heart attack, because the patient did not look that uncomfortable and so forth. So I think if there is any suspicion, it is really better to call the paramedics and come in. That way you come straight in, we assess you right away, and we can take care of it. People like me will be there quickly once we know what the situation is. A healthy diet, taking care of your cardiac risk factors, that is, if one is a diabetic, making sure you eat right and have your diabetes under control, have your blood pressure under control. Obesity is not good. Stay active, and if you are on medications, please take your medications. A lot of patients, unfortunately, don't do it or deny what they have, and it just serves to do them harm ultimately, and that's unfair on them, really. It's a dedicated group of folks. This is a hard life for all of us because we can be called in at a moment's notice. We have to be here within 20 minutes to take care of those patients, whether it is day or night or 4 o'clock in the morning, whenever it is. These people have worked hard and willingly. They get in the cars, they get here as quickly as they can, they prepare the cath lab, and all of that has to be done very, very fast. You cannot do it if you don't have a group of people that are dedicated, that have a good temperament, and really want to see their patients doing better. And cohesively, they really get along very nicely. So I have nothing but the greatest respect for the people that I work with. Without them, I certainly couldn't do what I needed to do. And if they had a bad attitude, it would make the work pretty miserable. And that is not the case. It really never has been the case. So we are here to serve the patients. And as one of my patients said earlier this morning, I am his servant. That's pretty much sums it all. That is what we are. We are servants of the patients. And anything that we can do to help make their lives a little bit better, we want to do that. And we of course do other things besides just heart attacks. We work on aneurysms, we work on legs, we put devices in the heart like pacemakers and defibrillators. We do carotid work. We do all sorts of things that come within our domain that we are qualified to do. I'm grateful for what we have here and the type of people we have here and their skills. It makes it really a pleasure to come here.